Have you ever wondered what the science says about certain foods, products, or treatments? Does chiropractic actually work? Should I only buy organic foods? Are GMOs actually harmful? Is adrenal fatigue real?
We've got you covered. The goal of the Unbiased Science podcast is to dispel misinformation and misconceptions across an array of science and public health topics. We love to debunk myths and help arm our listeners with information so they can make evidence-based decisions. Make sure to tune in to the Unbiased Science podcast to get all of your questions answered.
Hello. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach nursing concepts and share tips on how to thrive in school and at the bedside. So today we're talking about something that I see in the recovery room, and it's one of those things where I see something and I think, what's that all about? So we're going to be talking about that today. Before we dive into that, though, let's take a quick minute for our listener shout out. And this one goes out to Melanie, who says this: I just had to email you and tell you how awesome you are. I bought the MedSurge solution and I just watched the video on ABG analysis. That was amazing. So Melanie, thank you so much for that. And I think you're amazing. And yes, the lessons on ABG analysis are some of my favorite inside MedSurge solution, which is my program to help nursing students understand MedSurge concepts and supplement what they're learning in school. So if you're interested in learning about that and seeing all the amazingness that is the ABG lesson and many, many others, I will put a link to that in the episode notes. So what are we talking about today? Today we're talking about a medication called Methylene Blue. And it's more than just a medication. It was actually a dye, it's a stain, and it's used medicinally. So Methylene Blue is a medication that was initially developed way back in the late 1800s and was actually the first fully synthetic drug, and it was used to treat malaria. It was also one of the first medications used in the treatment of psychosis, which ultimately led to the development of phenothiazine antipsychotic drugs such as compazine and thorazine. Since then, it has shown to have quite a few uses, and yes, as the name suggests, it is blue in color. It's a very vibrant, it's actually a very pretty color of blue. So what is Methylene Blue actually used for? So its standard FDA approved use is to treat methemoglobinemia. This is a rare blood disorder that affects how red blood cells deliver oxygen to the tissues. So in methemoglobinemia, the ferrous component of the heme molecule has oxidized to what is called a ferric state. So it starts as a ferrous component and is oxidized to a ferric state. Methylene Blue reacts within the red blood cell to essentially reverse that oxidation and convert the ferric ion back to its ferrous state so the heme molecule can carry and deliver oxygen. So again, that's its standard FDA approved use, but there are other uses too. Though not FDA approved, you could see them utilized, you could hear them mentioned. So let's talk through what some of these are. I found this to be absolutely fascinating. So Methylene Blue can be used to evaluate the presence of a leak after surgeries that affect the bladder and adjacent structures like the prostate or the uterus. A Foley catheter is placed and the blue dye is instilled into the bladder. It's mixed with normal saline and instilled into the bladder through that catheter. The catheter is clamped and the dye is allowed to dwell in the bladder for a short period of time. And if there are any leaks in the bladder, the surgeon can easily see them because of that distinctive blue color, which will show, leaking out into space where there should not be anything leaking out. Note that a patient who had methylene blue dye instilled in this way will have blue-colored urine in the immediate post-op period as that dye comes back out through that Foley catheter. And then a study published in the journal Critical Care in March of 2023 showed that in septic shock, the use of methylene blue reduced vasopressor use, and length of stay. Note that methylene blue is definitely not part of the surviving sepsis guidelines for recommended treatments, but I would be really interested to see if more research is done in this area. Another use of methylene blue is to treat neurotoxicity and the resulting encephalopathy caused by ifosfamide, a medication used in the treatment of cancer. It works by preventing the formation of neurotoxic metabolites when this chemotherapeutic agent, ifosfamide, is used. So in that way, it prevents or reverses that encephalopathy. Another cancer-related use is in patients undergoing a mastectomy or lumpectomy with sentinel node biopsy. The blue dye helps map out and identify lymph nodes showing signs of malignancy. Methylene blue may also be used to treat something called vasoplegic syndrome, which is a type of distributive shock that occurs during coronary artery bypass graft surgery. If the patient doesn't respond adequately to a traditional vasopressor, methylene blue has shown to be effective in increasing systemic vascular resistance. And the medication methylene blue may also be used to prevent the pain associated with propofol administration when administered IV approximately 45 seconds before the propofol is injected. And lastly, it is also shown to be effective in treating malaria in areas that have developed resistance to the more traditional medications, which are chloroquine and pyrimethamine sulfadoxine. So however methylene blue is used, it can cause adverse effects. The most common is that bluish-green discoloration of the urine. Obviously, if it's instilled into the bladder, it's going to come out through the Foley catheter, but it can also just cause the urine to be bluish-green when it's taken intravenously. And it can contribute to serotonin syndrome if administered in patients also taking another serotonergic drug, such as SSRIs, MAOIs, and TCAs. And though rare, anaphylaxis can also occur. Toxicity can occur at high doses and cause cardiac arrhythmias, decreased cardiac output, decreased renal and mesenteric blood flow, increased pulmonary vascular resistance, and decreased gas exchange. Unfortunately, there is no antidote for methylene blue toxicity, and care is supportive. So if you've ever heard of methylene blue or seen someone come out of surgery with that blue substance in their urine collection bag and thought, what is that? Well, now you know. So I hope to see you back here next week. We'll be diving into ICU clinicals and what those are like. See you then. This podcast is brought to you by Straight A Nursing.